Clinical Outcomes Assessment in Practice, final project for patient-oriented outcomes. The patient population encompasses Air Force tactical athletes ranging from 18 to 28 years of age. There are 5 males. Injuries that are encompassed within the study are foot and ankle injuries, to include lateral ankle sprains, peroneal tendinitis, extensor tendinitis, and syndesmotic ankle sprains. Patient-reported instruments include both generic and specific patient-reported outcomes. Generic PRO includes PROMS Global 10-score scale, and specific PRO includes the Foot and Ankle Ability Measure. Both specific and generic PROs are Both generic and specific instruments are administered after initial injury evaluation. Additionally, instruments were re-administered 7 to 10 days post-therapy and treatment. For presentation purposes, you'll find that generic and specific instruments pre- and post-assessment have been grouped together accordingly to analyze the data of each patient specifically. Patient 1 presented with a right lateral ankle sprain. He was initially evaluated on May 5th of 2018 with a reassessment date of May 15, 2018. Comparing pain, fatigue, physical health, and overall health, we see that the patient has improved in every category over the 10-day period. While the generic PRO gives a good indication of the overall health of the patient, it is important to see the outcome of the specific instrument to determine the overall health and functionality of the ankle itself and patient. After review of the foot and ankle ability measure of the patient's initial assessment, you'll see that there is slight to extreme difficulty with functional and activities of daily living activities. Similarly to the generic outcomes reported by the patient, the specific reported instrument post 10 days of treatment and therapy demonstrates the patient himself feels, believes, and is improving in functionality. The second patient had right ankle peroneal tendinitis. Analyzing the initial and secondary generic instruments, the patient felt he had overall good health, quality of life, physical health, and mental health. While the patient initially was unable to physically perform up to his standards, within 8 days of treatment and therapy, the patient felt he was able to participate at his full potential. During the patient's initial evaluation and throughout treatment, the patient demonstrated no concerns for emotional or fatigue effects. Correlating the generic Global 10-score scale instrument with the patient's foot and ankle ability measure reported outcomes, the two instruments can be considered synergistic. The Global 10-score instrument demonstrates the patient feels healthy and is optimal with minor discrepancies. The foot and ankle ability measure instrument illustrates similar figures in which the patient has minimal discrepancies throughout his right ankle given his peroneal tendinitis. At maximum, the patient has difficulty with plantar flexion and extending on the toes. With therapy and treatment, the patient reports ease and rising abilities, being able to perform functional movements such as going up and down stairs, going up and down hill, squatting, and more. The patient feels they have little to no discrepancies compared to the initial assessment. Very similar to the patient with peroneal tendinitis, this patient has right extensor tendinitis within the foot and ankle. Based off of the initial and secondary assessments, the patient has no concern for fatigue, is not bothered by internal and external emotions, and feels like he is able to fully participate in physical fitness. Comparing the ankle and foot specific instruments between the initial and secondary assessment, the patient had minute improvements in his activities of daily living. Our fourth patient had a right lateral ankle sprain. He was initially evaluated on May 11th and reassessed on May 21st of 2018. Two things to consider here are his pain scale in addition to his performance of physical activities. Over the course of the 10 days of treatment, his pain scale decreased from a level 5 to a level 1. Additionally, his performance of physical activities increased from a level 2 to a level 5. Correlating the data between the generic and the specific instruments, we can see that the patient did in fact have difficulties with activities of daily living, which also is in correlation with the generic scale in activities of performance. The patient noted, due to his right lateral ankle sprain, they had difficulty with walking, going up and down stairs, up and down hills, squatting, standing on toes, walking for durations of time, home responsibilities, performing personal care, and light to moderate activities. Over the course of the 10-day treatments, the patient makes significant improvements across the activities of daily living. Our fifth and final patient has a left lateral syndesmotic ankle sprain. Initial evaluation date was May 14th, and reassessed was on the May 24th of 2018. Pain scale, initially his pain was 5 of 10, that decreased to a 1 of 10 over the 10-day treatment. He does seem to have some decreased physical fitness activities as well as a fatigue factor. Overall, his health seems to be fair. Given the 10-day treatments, you do see an increase with the generic scale. Looking at our specific instrument for foot and ankle ability measure for our patient with left lateral syndesmotic ankle sprain, you'll see that the patient himself has several difficulties to include, going up and down stairs, up and down hills, activities of daily living, squats, increasing walking time, so on and so forth. So patient wasn't really able to do much. Over the course of the 10-day treatment, this does improve significantly. Looking at the contrast at secondary assessment, we definitely see where he has improved significantly over that given period of time of 10 days. And so walking on even ground, walking uphill, downhill, upstairs, downstairs, walking on uneven ground, squatting, activities of daily living, increasing walking duration, all those do improve over that 10-day given period of time for our patient. A few barriers that I did have in regards to this project was one, limited amount of patients to assess and administer instruments to. So I work off of an 8-week schedule where I see 8 new students every 8 weeks, and so that doesn't necessarily mean that they're patients at that specific time. And so getting students in the door to be able to treat and administer these instruments was quite difficult for me to do. Challenges is I needed to better explain how the proms worked and what they were used for to patients. So I had many students initially just fill it out that they were okay, opposed to really taking the time to look at if this could be a benefit to them. Benefits for this project in particular, I think it was good for some students to see a change over time. From both a clinician and patient standpoint, kind of gives you a little bit to go back off on and look back at to see what progress has been made, or if you've made the right progress. And so definitely for future use, I'm planning on implementing a lot more proms within the clinical setting, and so I do feel that they're helpful. That being said, I do feel that both generic and specific proms are very helpful in their own way, and that both should be utilized. One, the generic looks over the health and well-being of the student overall or patient, and then secondly, the specific really looks at the extremity and the activity of daily living or specific functions that it can perform. So I do feel that both are necessary in addition to a clinician assessment to really determine the way forward in how to treat the patient the best way that you can. So, all right, thank you very much.